and Developmental Services Committee special session. Today is Thursday, September 10, 2015, and it is approximately 9:14 in the a.m. We have one bill to be heard, SB Special Section 214, Hernandez. Shall we establish a quorum? Call the members, please.
Hernandez?
Here.
Hernandez here. Morel? Anderson? Here. Anderson here. Bell? Here. Bell here. Hall? Leno? Here. Leno here. McGuire?
Here.
McGuire here. Mitchell? Here. Mitchell here. Monning? Here. Monning here. Morlock? Present. Morlock here. Nielsen? Here. Nielsen here. Pan? Here. Pan here. Wolk? Here. Wolk here.
Thank you. A quorum has been established. I will be presenting the bill. I will turn the gavel over to our Vice Chair. Thank you.
Quorum is established. We are convened, and Senator Hernandez, our chairman, will be presenting SB X214.
Thank you, Mr. Chair and members. It's a pleasure to be here this morning, and good morning. This bill is the only comprehensive piece of legislation that directly addresses the shortage of funding for California's most vulnerable communities and presents a solution for all the problems identified in the governor's call for a special session. This bill will guarantee funding to improve quality and expand access in the Medi-Cal program. It'll restore funding for our developmentally disabled community and clearly demonstrates California's commitment to help those that need it the most, including seniors, children, families, and individuals with special needs. This bill would implement a $2 per pack increase in the tobacco tax estimated to generate more than $1 billion annually, as well as an equivalent increase in e-cigarette products. The revenue would go towards increasing Medi-Cal reimbursement rates to help improve access to quality providers and improving network adequacy for Medi-Cal recipients. The remainder of the revenue would go towards existing tobacco-funded programs, including law enforcement and smoking prevention efforts. This bill would also extend the tax on managed care organizations, what's called the MCO, to provide additional money for the healthcare system and an increase of $230 million annually for regional centers and providers of services to the very much needed developmentally disabled. As a result of the matching dollars we get from the federal government under Medicaid, this proposal increasingly generates $1.3 billion annually, with only $300 million aggregate net impact to the non-Medi-Cal health plans. That represents a net financial impact to non-Medi-Cal plans. It is more than half the amount of other proposals presented to date. This bill is a win-win for Californians, as it will not only generate much needed revenue for healthcare and developmental services, but will also help reduce smoking rates and deter young individuals from getting hooked on a deadly habit of tobacco. The revenue generated by enacting this bill will help provide care for the most underserved and neediest communities in California, and as a society, we cannot continue to ignore this crisis for help. And when the governor proposed the special session, it was very clear what was in it, that we needed to look at additional revenues to help the most neediest and vulnerable in the population, but also we had to look at making sure that we have the MCO tax, which in some form or another has been brought forward to the legislature, has been approved on a bipartisan manner, and if we don't have that money, that is that much more of a hole that we're going to have to fill for the vulnerable population. And I must say I've had the pleasure of working with the administration, working with all of the plans. I know we're not quite there, but there is significant progress towards a resolution. And I am optimistic, but more importantly, committed to making sure that we have revenues that are available for the most vulnerable here in the state of California. So, Mr. Chair and members, I want to thank you for allowing me to spend some time this morning to make this presentation. I have witnesses with me in front that I'd like to allow them to present, and thank you.
Please proceed with your witnesses. Senator Hernandez, the first one, please identify yourself by name and then proceed.
Good morning, Mr. Chair and members. Michelle Cabrera with SEIU California. On behalf of our 700,000 members, I want to thank the chair for your commitment and your leadership in bringing this measure forward. I will remind the committee that the charge of the special session put forward by the governor was to find at least $1.1 billion for the Medi-Cal program to restore for the MCO tax, restore the 7% cut to IHSS beyond 2015-16, and provide additional rate increases for both Medi-Cal providers as well as developmental disability services providers. The bill before you accomplishes all of those goals. And it is extremely important for us as we move forward to ensure that the Medi-Cal program does not backslide, that we do not waste energies next year contemplating cuts to a program when we could solve this problem now. I understand that the conversations are ongoing related to the managed care organization tax, and that we may be making progress. As Senator Hernandez mentioned, the proposal before us, it accomplishes an incredible feat by leveraging $1.3 billion for the Medi-Cal program with minimal investment from the plan community writ large. And the IHSS program restoration is incredibly important as an ongoing effort. This bill would repeal that cut. It's the right thing to do. IHSS providers and their consumers depend on every hour, and so we urge your support for this measure.
Beth Cabell on behalf of Health Access California, also here in support and in support specifically of both the tobacco tax increase as well as the managed care organization tax. As my colleague said, this special session was called to address the need to revise the managed care organization tax. The proposal that is before you today seems to us an improvement over the earlier proposals. We do understand that there's further work going on. We too are committed to finding a solution to this problem before we face a January budget with a more than $1 billion hole in the Medi-Cal program. We think this is a very important part of moving forward on assuring that everyone who depends on Medi-Cal, the 12 million Californians, have the access that they need. We're also supportive of the tobacco tax. We would point you to a recent policy brief by CPEN, the California Pan Ethnic Health Network, a member of our board, that indicates that the communities of color and low-income communities are disproportionately affected by tobacco, and that a tobacco tax that reduces utilization in those communities would help to improve the health of those communities even more than the rest of California. So for these reasons, we're pleased to be in support.
Next.
Tim Gibbs, American Cancer Society Cancer Action Network, and we are very supportive of the effort to raise the tobacco tax in California. Raising the tax will help prevent kids from smoking, help tobacco users quit, and reduce state health care costs and save over 100,000 lives. It's estimated that nearly 40,000 Californians die from smoking every year. There are 441,000 children in California who are alive now that will die prematurely to smoking-related illness. It's the single largest preventable cause of death. Smoking kills more people than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides combined. The annual health care costs in California directly caused by smoking are $13.29 billion. Smoking caused productivity loss in California is over $10 billion, and Medi-Cal covers $3.5 billion of those costs every year. A $2 tax would ensure that at least 295,000 Californians would smoke less or quit altogether. Youth are particularly price sensitive to increases in the cost of tobacco. You know, studies have shown that there's, for every 10% increase in the price of tobacco, there's a corresponding 6.5% decrease in the use of tobacco products by youth. A $2 tobacco tax increase would prevent more than 150,000 children from starting to smoke every single year. It's been 17 years since California last passed a tobacco tax. We're one of only 3 states not to raise the tobacco tax in the 21st century. 32 other states that have higher cigarette taxes than we do. So raising the tax would save thousands of lives and billions of dollars in California. That's for your support.
Mr. Chair, members of the committee, Brian Allison on behalf of the American Federation of State, County, and Municipal Employees. To date, this is, as the author has pointed out, the most comprehensive package that's come forward, addressing the critical needs dealing with the MCO tax and with the Medi-Cal, the deficit, impending deficit in the Medi-Cal budget. We have been working, our organization, as well as many organizations and other unions who deal with the IHSS world, have been working for years to provide a sustainable funding stream to restore the 7% cut to IHSS services. This bill does exactly that. We would be remiss if we didn't support the author for his work to try to bring everyone together, have a conversation about how we continue to move the ball forward and make sure that hundreds of thousands of Californians in this state have access to IHSS services, critical services that they need to have some dignity in their communities and their homes. And quite honestly, we also know that going forward, as many of my colleagues have pointed out already, that further work must be done. But we like to thank the author and would like to reiterate our strong support for this piece of legislation.
Mr. Chairman and members, Carl London on behalf of the California Disability Services Association. We're an organization of agencies that support people with developmental disabilities statewide. We are grateful to Senator Hernandez and many of you for jumping into this fray and bringing a solution forth. We've well documented the fact that our smaller agencies are simply going out of business. Our larger agencies have all the signs of failing. They're eating through their reserves. They're refusing to take on further clients that are referred by the regional centers, and they're having huge transitions in staff because of their inability to pay wages that correspond to the job they're doing, and they're losing them to other people, including restaurants and other places that have nothing to do with our industry. We have to have a solution. It's not a lot of money in our piece to fix and stabilize the system, at least for the time being. And I'd remind everybody that we've had one rate increase in 15 years in this situation. Nobody can run a business and provide care and services with that sort of support. We've had one rate increase in 15 years. We have to have a solution. Now's the time for everybody to come together and find one. However you guys get there, we urge you to find a solution to address this situation. Our people really are the new face of poverty. The people with developmental disabilities, their family members, are being thrust into poverty simply by what we're willing to fund in the state of California. We urge you to fix that. And again, we want to thank Senator Hernandez for including this in the solution. And we urge all of you to find a solution, particularly before you leave this Friday. Thank you very much.
Mr. Chair and members, Rick Rollins here on behalf of ARCA, the Association of Regional Center Agencies. As you know, the regional centers are the 21 not-for-profit organizations that provide services through its system of vendors throughout California for people with developmental disabilities. And I'm also a parent of a 24-year-old son with autism who's been served by the regional center system since the age of 22 months old. I'm here, first of all, to thank Senator Hernandez and all of you for your commitment to people with developmental disabilities. I know each and one of you has stood up and supported our great need this year for the 10% increase. We do want to offer up, through the good auspices of Senator Bell, some potential amendments to the bill that we think will strengthen the legislation. The first thing would be to raise the dollar amount so it does reflect a true 10% increase for the system. Number two, we'd like to see some language in the bill that makes it clear that this money would not supplant current budget, but would supplement the budget. And then thirdly, we noticed in the technical language in the bill, want to make sure that the providers that serve our system, all the providers, including the early start providers, which because of a technical drafting error in the bill, they're not included in the bill, be included as part of this solution. And again, both as a parent and a professional, we're very fearful, not only for not seeing an increase to try to backfill the over $1 billion in cuts that the this program has received over the last few years, but we're very, very fearful of what will happen if you don't act now and come January when the governor is faced with over $1 billion in reductions to try to backfill that money with what we know will be cuts in human services programs. So thank you for your consideration, and we strongly urge your aye vote.
Mr. Chairman, I have a question for you. Mr. Rollins has offered a bunch of amendments. Are you entertaining any amendments in the committee today?
So not at this time. I am looking at potential changes either at or before the appropriations. But keep in mind that the absolute most important thing is the funding source, because no amendment is going to mean anything unless we actually have the money that we can spend it on. We need to come to a resolution very soon, which we're working diligently with the plans, et cetera, to figure where it is. But I'm always going to be open, because the administration has amendments to the MCO portion of it. So yes, I'm amenable to it, but I mean, not at this point. We have to first figure out and look at them as well.
But it would be said the bill is a work in progress before it may get to the floor tomorrow.
Correct.
Let me move. All right. Then the people who are lined up there, I trust, are all supportive. Please state your name and indicate your support.
Mr. Chair, Mr. Chair, some of us have to get to other committees. We have a lot of committees going at the same time right now. And if I can make some remarks, because I have to go to the other committee.
Proceed.
Then I'll come back.
I didn't realize you had statements to make, but proceed. If
And
you
questions,
centered more
Mr.
like
Chair. And some questions.
Okay.
So
I was going to get that after, but we'll do that all now, please.
I apologize, but I have to go to another committee so they can establish quorum. And I agree with all the goals of the bill. What I don't agree with is that over the last 3 or 4 days, we've approved over $1 billion of new spending on the Senate floor. The governor has the ability to veto all those bills, and he has surplus money to spend and reinstate these folks the way they should be, the way you're working for it. But to turn around and use them as political pawns for political purposes to fund those programs that were supported on the Senate floor on the backs of these poor people is wrong. They should be in the budget. They deserve to be in the budget. They're core services. They should be treated as core services, not set up on some flimsy tax that may come or go. We know as we increase those taxes, fewer people are going to purchase cigarettes, and they're still not going to have the revenue. In fact, if I read this correctly, this grants the Department of Health Care the authority to raise the MCO tax without any oversight whatsoever. So we're advocating the authority of the legislature to the administration, to the department, without any oversight whatsoever. That's wrong. It's in the wrong direction. I want to fight hard for these people, but I want to do it in the right way. These, we stopped the Healthy Families Program, started the CHIP program. Last year, we received a surplus of over $300 million from the CHIP program. That money should have stayed with the CHIP program or with that community. They deserve that money. Instead, it went to the general fund and was spent on something else. That's wrong. When you have an excise tax on cigarettes, it doesn't go to stop people from smoking. It doesn't go to their education. It's used for something else. The idea of an excise tax is the wrong direction, because what it does is it devalues what the tax is for, and then people can play these shell games, which ultimately leading to them being used as political pawns. They should be in the budget. They deserve to be in the budget. I'll support them being in the budget, and I'll support the governor's vetoes of all the new spending to ensure that these people are taken care of first. So, let's see. I think that's pretty much everything I had to say. I applaud the author for trying to close the gap so that they achieve their goal, because I agree with those goals. But what I won't be doing today is supporting a flimsy way of taxing when they deserve and belong in the budget. They're a core service. They deserve core funds. Thank you.
I was going to reserve remarks for later, but it is that now. As one of the authors of 2 major bills, along with Senator Stone, would have provided answers that were introduced as early as mid-July. Our bills, Republican bills, were not even allowed a hearing And I resent that. That is not in the spirit of bipartisanship, and I do not fault the chairman. He's always been as agreeable as he possibly can. But to cut off, even from consideration, other ideas of other members, and to have rejected throughout the budget process other Republican ideas short of tax increases, that's not good for the legislative process. Ladies and gentlemen of the public, I speak to you, that's not good for you. Senator Morlock, you had something to say? Okay. Senator Leno.
Thank you, Mr. Chair. I also have to get to the Judiciary Committee for bills, so I appreciate your letting me make a few comments and ask a few questions. First of all, Senator Hernandez, it's great work, and I know we also owe some thanks to Jennifer Kent and her office for this retooling and remodeling of the MCO tax that, as I understand it, will meet the scrutiny of the federal government and at the same time brings much greater equity. And there are few last weeks, right, I understand, but we're getting very, very close. So that's all great news. With regard to the developmental disability restorations, I'm not quite sure how we landed on the $230 million. My understanding is that the full 10% would be $309 million, and as was already stated, this is about 75% of that. Correct. So then my question would be, number one, was our intent to shoot for the entire 10 or just up to 10? Short of that, are we then going to do a 7.5% restoration across the board, or are we going to do some targeting restorations? That's, I would imagine that's something we should resolve before we get to the floor. And maybe the most expeditious would be the 7.5% across the board. But I want to hear from the community rather than to suggest I know better. So maybe that's a good first question. Sir?
So, you mean, yes, I am definitely in support of a, full restoration. But as I mentioned earlier in a comment, that first we have to get the money allocated and approved and then kind of figure out how we're going to get to that point. Yes, we're down to 2 days. Yes, we are coming closer. There's not resolution, but this will be work in progress, up until we're here till midnight tomorrow we have to be. But, I'm committed to trying to restore as much as we possibly can.
Okay, and then if we don't do the entire 10% and it's at about 7.5%, what would the suggestion be? Targeted restorations or across the board?
Senator Rick Rollins, the legislation right now basically allows for a across-the-board increase, both for providers and for regional centers, and the Association of Regional Centers strongly supports that position. The language allows for an increase up to 10%. And again, we want to express our gratitude for what's in this bill. But again, we feel very strongly that the 10% that we asked for and lobbied all of you so strongly for this year was not a number that we pulled out of the air, but one was based on fact and on need for our system.
But the 10% would be higher than the 230.
Yes, it would. You were correct in your estimate. According to the Department of Developmental Services, a 10% increase in our system in both operations and POS would be approximately $308 million, about $78 million less than what's in the bill right now.
More than
excuse me. Right. We would need $78 million.
And that's in the current year. It'll probably go up in the budget year.
Yeah, this is based on the current budget year.
And you're sounding very positive and confident today, and I'm glad to hear that, but I'm going to be just a little bit more concerned. I don't want to say doubting. My understanding is we can't put an appropriation in this bill, but until we have the appropriation, I'm concerned that this could slip through our fingers again. Is this much more than intent language?
It is, in my view. This legislation would not take effect until July 1st, 2016, of course, because we know the current MCO tax does not expire until that point. So this bill would not have an impact on the current year budget.
So we recognize that.
We do.
But it will take an appropriation in the next budget to fulfill this language.
Absolutely. Yes.
I don't want us to be in the same situation we've been in years past. and I think we can speak forthrightly here. Much of the resistance to the restoration has been with the administration.
Correct.
So I'd like some kind of greater certainty that this money will be in next year's budget.
Amen.
Yeah.
So let me kind of answer and follow up on the comments and what you said. I very clearly made a conscious effort to put this language in this bill to send a statement to the administration that this is a priority, not only to me as a legislature, but to us as a caucus as we spoke yesterday. And I think if the money were to come through a MCO, because we don't even know what the full amount is going to be, because we're, into the final hours of negotiation, whatever we do get, this has to be a priority for this body. I mean, and there's a statement that we're making not only today, but to the administration.
And I'm not sure if LAO is here, if I could, I just want to, so would we be?
The journalist out there?
So my question would be, with the language in the bill, which we believe is more than intent language, it puts into statute that this shall be with restoration relative to the developmental disability services, that if, because of administrative resistance or for whatever reason, this 230, and I know it's a moving target right now, were not to be appropriated in our budget next year, would we be liable for lawsuits, or would it just not happen? How serious is this language?
In Legislative Analyst's office, I'm not sure, Senator, what the answer to your question is, but we'd be happy to be in communication with your staff and get back to you on that.
If you could, and I want to make this real clear. I am not doubting, I'm really appreciative, Senator Hernandez, of your leadership, because you made this happen in your negotiations. But and I don't doubt any of our commitments, but I just want to make sure that we don't just feel good about passing something now and that we still have to debate this. I don't even want to debate this next June, that the action we take today and tomorrow is definitive and final and will require, not consider an appropriation, it will require an appropriation in June, because we've been around this block just too many times before. And I know that this restoration for developmental disability services has strong bipartisan support. I know we're not going to get all Republicans on the MCO. We need a couple. But I know that this should be a sweetener for any 1, 2, or 5 Republicans to join us, because they will know that this money will go for something we all hold dearly. So that's my one question, my one point. And then with regard to the cigarette tax revenue, our goal is to decrease tobacco use. And we know that when we raise the tobacco tax, it will, over time, decrease revenue. Is it 6 months out, 12 months out, 2 years out? At what point do we actually begin to bring in less revenue than the current 87-cent tax brings in currently?